In an earlier video I talked about cracked teeth. What are the causes of cracked teeth? Today I'll talk about some of the signs and symptoms. Cracked teeth can be very difficult to diagnose, even for dentists. We actually have a term called cracked tooth syndrome. And the reason is because we can't always see the crack. Sometimes you can see a crack on the top part of the tooth. Sometimes those are superficial. Those not necessarily a problem. They're like what I would call a craze line. Crack only becomes significant is when the tooth starts to flex, and one of the symptoms that people will describe is it hurts to bite when I bite in this way, or I bite something hard. They can chew something soft, it's not a problem. When they bite something hard enough, the tooth starts to flex, and that can give a zing or of pain, usually just for a few short seconds, and it goes away. In later stages, as a tooth flexes more and more, the tooth can start to become sensitive to temperature, first to cold, which lasts once again seconds and then goes away, but then eventually as a tooth gets more irritated, nerve gets irritated, the tooth will start to react to even hot. And if it progresses long enough, the tooth will become irreversibly inflamed, what we call pulpitis, and then the tooth you either have to remove the tooth or do a root canal if you want to save it. The other way we can identify cracked teeth is sometimes with the health of the gums around it. The other common place where teeth crack is actually in the root structure. So we can't see it clinically when we look in the mouth, because the root of course is in the gum and in the bone. But what we'll see is if we look at the health of the gums around the tooth, and we can measure around the tooth, which we do quite frequently, and we'll see that the gums are healthy and a normal depth or pocket depth of 1, 2, 3 millimeters. And right where the crack is, we'll see our instrument disappear. And that indicates that there's been a localized area of bone loss around there, and almost always that is due to a vertical crack in the tooth. X-rays will sometimes show that. We can take film of a tooth and it sometimes will show the pattern of bone loss, which is typical of a cracked tooth, but not always, for several reasons. One is because an X-ray only shows bone loss, so unless it's been there for a while, that bone loss may not have developed well enough to be able to see on an X-ray. Secondly, it could be the crack could be on the front or the back half of the tooth, which on a two-dimensional film you will not see it. We have CTs now, which we can take of a tooth, a localized CT scan, which is a three-dimensional image, so we can look at a tooth and almost literally walk all the way around it or look all the way around the tooth. So if there's bone loss on the back side of the tooth, we can see that. And in some cases, if it's a really high resolution, we may actually be able to see or identify the crack on the tooth in the image on the X-ray itself. But basically, as far as how do we identify or how do you suspect a tooth that's cracked, if you bite into something as hard and or you bite in a certain way, you feel a flex, it's uncomfortable, especially as you bite. You don't feel it, but as you let go, you feel that zing. That's pretty indicative of a crack. So hopefully these little tips will help you, and hopefully you don't even have a cracked tooth, but if you do, this might help you to understand what's going on.